Hi, my name is Robert Pollock, and this is my video reflection for the final practical. So over the course of ATTR 363 lab, I think that I've made a lot of improvements. Some of these improvements would include like telling patients what I think is going on in terms that they understand. So for example, in the SP, I described what piriformis syndrome was. So I said the muscle that is over that nerve is really tight and it's compressing on the nerve, which causes that tingling and possible paresthesia or loss of feeling. Using those words was really important, especially like with athletes that don't know what you're talking about. So getting them to understand what is going on so that they can appropriately take care of what they're doing. Another thing that I feel like that I improved on is patient-centered care. So, for example, in the practical, I asked what you were training for, like what were you running for to train for, and he said a marathon, and I was just simply asking what marathon, when is it, so we can try and get you back to running and doing your full potential before the marathon, so you can actually be a part of the running group you're in, and get back to what you want to do. Normally that would not, in the beginning, that would not have been anywhere near my eval. It would have been basically trying to find the pathology and then telling him this is what I think it is, and I don't know what you can do for it, but this is what it is. The last thing that I feel like I made major improvements on over the course of this semester was having a way to instruct my patients on what I wanted them to do, especially like with range of motion testing. So I want you to flex your hip. Well, how about I just want you to bring your knee to your chest and vice versa. So just finding ways that they could understand what I wanted them to do without the medical terms. Again, going back to using the layman's terms to describe things. Because of this improvement, I feel like the areas of strength that I had during the final were that I bilaterally compared everything: range of motion, manual muscle test, passive range of motion, active, special test, and even neuro screen because of the piriformis syndrome, and looking to see if it was a nerve pathology that was causing the tingling or his other symptoms. Another thing that I believe that I'm a lot better at, I want to consider one of my strengths, is that I can communicate with the patient. So having said that, like just trying to figure out what's going on in their daily life, why it's a big deal to them, why this injury is really debilitating to them. Even if it's something as simple as I stubbed my toe, there's a reason that they came in to see you. There's a reason they came in. There's something wrong. So communicating with them and figuring out what their goals were and what their main concerns were with the pathology is what I consider one of my strengths. The final thing that I think I have a pretty strong grasp on is the knowledge of common pathologies. So, for example, lateral ankle sprain, I know what it looks like, clinical presentation, ACL, stuff like that you'll see pretty much hopefully not every day because you're preventing those injuries, but if it happens, you can easily understand it, what's going on, and know how to confirm your suspicions. So with that brings me to like my goals for next semester. So looking into the next semester, this practical, it was awkward doing passive range of motion assessments with a goni. So looking at passive range of motion, when I do it next semester, I'm going to try and get more comfortable using the goniometer to do passive range of motion especially with the hip pathologies that I've had. It's kind of a bear to struggle with the person's entire leg. There's a lot of weight to it, and also trying to line up the goniometer with all this points that it needs to be lined up on. Another goal is that I wanted to improve on is my resistive range of motion technique. The technique, not so much is the problem, it's learning how to document it. So I want to improve on, okay, he had a struggle with in 30 to 60 degrees, but when he's in full range, full extension or full flexion, there's no weakness. So one of my things is, how do I document that so that other people can understand what was going on? Do I give it a manual muscle test score? Do I give it, you had restrictions within 30 to 60 degrees of motion? Lastly, I'm not very comfortable with lumbar and hip pathologies for the most part. I believe that's probably due because we haven't really covered a lot of it yet, and we'll touch on it more in practicum coming next semester, but I really want to improve my knowledge of lumbar hip pathologies and special tests so that I can be an effective clinician to all my athletes. And then the last bit of information is how I think that the SP helped me clinically. The biggest advantage for the SP, in my opinion, was that it provided me a platform to practice my clinical evaluation that I may not be getting at clinical sites. So with that being said, it gave me there was a grade associated to it, but it gave me suggestions on how to improve. So for my first one, I did not even look at the other leg. So it gave me you need to look at the other leg, you need to do this bilateral, you need to do this. And in my opinion, it helped me a lot as a clinician develop confidence and develop my own style for doing all these clinical evaluations. And the other thing is, if I would have learned at some of my clinical sites, I don't think I would have learned the correct evaluation process. So, like we talked in class, one of the main things is that not a lot of people use goniometers to measure range of motion. So being comfortable with using a goniometer, especially with active range of motion, is really important so that I can, at some point when we switch to third-party reimbursement for our payment method, we can prove that what we're doing is beneficial to our patients and shows that we are doing things that are returning our patients back to play. I believe that's it. Again, my name is Robert Pogg, and this is the evaluation, my self-evaluation for the final and the semester of ATTR 363 Lab. See you next semester.